Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How depression is diagnosed. Depression is diagnosed based on your symptoms and how long you have had them. There is no definitive test for depression. Instead, your healthcare provider will use the diagnostic criteria in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, to assess your symptoms. They will also rule out other mental and physical conditions that could be causing your symptoms. /r/n/r/n struggling with depression, also called major depressive disorder, can take a serious toll on every aspect of your life. If you suspect your mood or behavior changes are related to depression, it's important to talk to your healthcare provider to find out if you have this mental disorder. /r/n/r/n This article goes over the different ways healthcare providers evaluate and diagnose depression. It also discusses some of the other mental health conditions that might be mistaken for depression. /r/n/r/nChinnapong, Getty Imagesrnrnrn If you or someone you know are having suicidal thoughts, dial 988 to contact the 988 Suicide and Crisis Lifelineand connect with a trained counselor. If you or a loved one is in immediate danger, call 911./r/n/r/n for more mental health resources. See this National Helpline Database./r/n/r/n to begin the diagnostic process. Your practitioner will ask about your symptoms, as well as past and family history of medical and mental health conditions. /r/n/r/n If your healthcare provider suspects you have depression, you may then be referred to a mental health professional like a psychiatrist, who will determine whether you meet the DSM-5 diagnostic criteria for major depressive disorder or another psychiatric condition. /r/n/r/n Symptoms of depression include feelings of sadness, low mood, and loss of interest in usual activities. The symptoms must represent a change from a person's previous level of functioning and have persisted for at least 2 weeks. /r/n/r/n They must also be accompanied by 5 or more other common symptoms listed below, and the symptoms must cause significant distress or impairment to social, occupational, or other important areas of functioning. /r/n/r/n Importantly, these symptoms cannot be the result of substance use, for example, medication side effects or drug abuse, a physical illness, or another mental disorder. In addition, there should never have been a manic or hypomanic episode. /r/n/r/n Your healthcare provider may also use a screening test to assess the severity of your symptoms. Some of the most commonly used screening tests include :/r/n/r/n Your healthcare provider will also want to rule out other potential causes of depression-like symptoms, so they will perform a series of blood and urine tests to check for underlying physical illnesses that could be contributing to these symptoms. These tests may include /r/n/r/n Online tests for depression can be useful in helping you recognize if you have symptoms warranting clinical attention, but you can only be diagnosed by a healthcare provider or mental health clinician. /r/n/r/n These online screens cannot confirm the diagnosis, and they don't all come from credible sources. Make sure you take a test from a reputable source such as a teaching hospital or academic institution, and always bring your responses to your clinician. /r/n/r/n The American Psychological Association compiled a list of evidence-based online screening tools for depression. Some are the same tests used by healthcare providers. These tests are available in the public domain and are free to use. They often ask about symptoms you have experienced over the past 2 weeks, such as /r/n/r/n You'll likely answer these on a scale-based system that will help you better understand to what extent these problems have been disrupting your life. /r/n/r/n An online test can help you understand your symptoms, but only you know how your symptoms are affecting you. If you have symptoms that are so severe they interfere with your daily functioning, or if you no longer feel like there is any pleasure in your life, it is important to seek medical attention right away. /r/n/r/n A number of other mental disorders in addition to major depressive disorder can manifest symptoms of depression. /r/n/r/n There are different types of depressive disorders. Each type has its own specific range of symptoms. The DSM is frequently updated with new disorders or changes to the classification of existing disorders. These are some of the most recent changes and additions to the DSM. /r/n/r/n No single test can definitively diagnose depression. Instead, your healthcare provider will ask about your symptoms and how long you have been experiencing them. They will use this information to see if you meet the DSM-5 diagnostic criteria for major depression. /r/n/r/n Your healthcare provider may also order tests to make sure that you don't have any health problems that could be contributing to your symptoms. /r/n/r/n If you suspect you might have depression, you can also complete an online evaluation that can help you decide whether to seek treatment. Look for tests that come from reputable sources. Regardless of what an online test tells you, if you feel you are depressed, it is best to see your healthcare provider. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.